Dentists claim a move to restrict checkups to once every 2 years could put lives at risk. A study by the British Dental Association indicated that 97% believe the reforms would put oral cancer detection at risk. Survival rates from the disease increase from 50% to 90% if it's detected early.
The plans published by the Scottish Government earlier this year suggest that patients considered to be at low risk could be examined at intervals of 24 months. Louise Scott reports.
Peter Young was visiting his dentist for a routine check-up 3 years ago when something was spotted under his tongue. 4 weeks later, he was diagnosed with oral cancer and had to undergo an 11-hour operation, replacing tissue on his tongue with flesh from his arm.
I wouldn't want anybody to go through what I went through. And tomorrow is my 70th birthday. If my dentist hadn't picked it up on me, I'd be dead now. That's as simple as that.
But under a new system outlined by the Scottish Government, an oral health risk assessment would be introduced for every patient, with a frequency of checkups determined by their overall score.
A significant number of oral cancer cases do not have high risk factors, and so under a health assessment would be put on a 24-month recall. But if the cancer isn't detected early, their chance of survival almost halves.
Dentists believe this move will put more people at risk and will inevitably cost the NHS more.
By 2035, we think the incidence will increase by 33%. Now, leaving it for longer before you have recalls with patients will mean that more cancer will be picked up late, and therefore it will be more costly to treat these patients. And more importantly, more of these patients will die.
But the government say it's not about the savings, and no final decision has been made.
We've not said 24 months. The researcher said it's a possibility, but again, that's for the decision that will be made with the dentist and the patient together about what is the best interval between checkups. So, you know, they're right to raise their concerns. We will have another period where we discuss with the profession.
It may be the chair some of us dread to go to every 6 months, but this check-up is about much more than polishing your teeth. Louise Scott, STV News, Edinburgh.